Hello, most of us have met, but I am Sarah Simmons, and I am also from St. Louis University. I will be sharing with you some of my research experiences from the summer. I entitled the study An Analysis of the Racial, Economic, and Educational Factors in St. Louis Cancer Rate Disparity. I would like to point out my mentorship that I've had throughout this project, Dr. Maria Schutman, who works at SLU and SSM Health, and also Dr. Schmaltz from the Missouri Cancer Registry. In St. Louis City, there exists a geographical barrier often referred to as the Delmar Divide. This is a physical divide made by Delmar Boulevard in the city. Here you can see some of the disparities on either side of Delmar Boulevard, including home value, income, and education. This divide is a result of long-term segregation within the city and also redlining back in the day. This division also manifests with differing crime rates and commerce in the city. It cropped part of the text, but that's okay. You can also see the relationship here exists throughout the county, not just next to the divide itself, with differing heart disease or differing race and poverty rates. And you can see that these patterns mirror each other, with the north being the disparate group. This is what you're supposed to be looking at. This is the one that you're supposed to be looking at, sorry. Here you can also see the heart disease rates and access to healthy food choices. It's a little less clear, but you can still see that the disparity exists. And then here you can see that it even goes as far as life expectancy within the county, with life expectancy differing as much as 18 years depending on what zip code you live in. In this study, I hope to look at whether rates of cancer, incidence, survival, staging, and mortality differ across St. Louis County, such as they do with heart rate, and then how the social determinants of health affect these rates. In my methods, I looked a lot into the history of the Delmar Divide, why it exists, and what research has gone into it previously. A lot of my information was taken from the For Sake of All report, which was published by Washington University in St. Louis, and is a great resource if you're interested in the topic. I first had to choose appropriate zip codes that fell north and south of Delmar Boulevard, which I will show you a map of in a moment. And then I had to select which cancers I would be focusing on. I chose the several most common within the population. So then I had to determine data sources for the rates that I would be looking at. Incidence and survival will both be coming from the Missouri Cancer Registry. I should have those any day, but I don't have those currently. And then mortality and stage of diagnosis, which I also do not currently have access to. I will then be analyzing these rates to see if there is a statistically significant difference between the two populations. So here's a map of St. Louis County, and you can see where I have designated certain zip codes as following either north or south of Delmar Boulevard. I chose to measure by zip code because this is the smallest unit of measurement that the U.S. Census, the American Community Survey, and the State Cancer Registry has in common. There are 23 zip codes that fall on either side of Delmar, and I only went as far west as zip codes that touch Delmar Boulevard because I didn't want to lose the relationship by going too far west. Some of the zip codes closer to the divide fell like on both sides, but it was very obvious which zip codes were like a majority on the north or a majority on the south. So these are just the differing rates of race education, insurance coverage, poverty, employment, and age in my sample population. You can see here that there is definitely a difference in the racial makeup of each section, with 75.5% of the South being comprised of white or Caucasian citizens, and then 63.5% of the north side being Black or African American members. There's less of a disparity whenever you look at high school education attainment, but then whenever you look at higher education, the disparity is again very clear, with the south side having roughly twice as many college graduates. The insurance situation was also very interesting. There is differences between private and public health insurance coverage, but what I found more interesting was the difference in people who had no health insurance coverage, with members of the North County being roughly twice as likely to not have current insurance coverage. Poverty makeup was also roughly 2 times the difference, with more people on the north side being under the poverty level within the past year. Again, roughly twice the unemployment rate in the north side is the south side, and the footnote actually has a typo. The distribution of income and benefits favors the north, but the table was so large because there's so many brackets of income that I didn't want to worry about including in this slide. And then the age makeup was also interesting to me. It's not a very big difference, but the north side is actually younger, which should be a protective factor for most cancers. So thus far, I've focused on looking at my sample and determining whether or not it was representative of the county as a whole, which it seems to be based on the rates that I just presented to you. Once I have the data from the Missouri Cancer Registry, which I should have very soon, I will look more into the differing rates that are present. In this experience, I have really learned a lot about the real-world research experience, and that it spans a lot more than what's covered in class, which is just like the analysis. Usually the data is given to you very neatly. And I've learned that whenever you are using data collected by a government organization, there's a lot of red tape and a lot of steps that you have to go through. Filling out paperwork for people, and then they'll refer you to someone else so that you can fill out more paperwork. And that takes a lot of time that I did not expect to spend doing that. I think that the biggest lesson overall that I've learned is that you have to be flexible, both in terms of your timeline and the data that you hope to use. So future students could definitely use this data. I have compiled a database of sociodemographic variables for St. Louis County and the zip codes within the county. So if anybody wanted to look at other health outcomes in St. Louis County, they would already have that. This methodology could also be applied to other urban areas that have had a history of racial segregation, and this can serve as a baseline for future cancer interventions within the county. A strength of my study is that I used pre-existing data. I didn't have to conduct the survey myself, which reduces some risk of error on my own part. And I also had really great mentorship who had been working in St. Louis County for a very long time and are really passionate about the community. Some weaknesses are the governmental protocol for accessing data. I was not expecting that. And I also initially wanted to use individual level data where each cancer case was a data point and I had their own personal income, race, etc. But accessing that data did not seem feasible. So I'll be applying the average sociodemographic data for the zip code to everybody living within the zip code. Some future goals of mine include completing this study, of course, graduating with my MPH in epidemiology this May. I hope throughout my graduate studies to continue gaining exposure to research, especially relating to special populations. I would like to get a PhD eventually, but I'm not exactly sure when that's going to happen. And I hope to always continue growing as a public health professional and researcher. Do you have any questions? I see someone in the back had a question.
Okay, my question is relating to how to the data. So the first question is the cancer data individual at the individual level?
The cancer data is at the individual level, but they're reporting it in zip codes. So, like, I'll have mortality counts for each zip code.
Okay.
Incidence counts for each zip code.
Okay, so basically it's like a type of ecological database, not.
Yeah.
Okay.
Yeah. It was the sociodemographic variables that I won't be able to have individual results for each patient. So I'll have to apply the average for the zip code to everyone living in that zip code.
Okay, so at the zip code level for the cancer data, what exactly are you analyzing? So that's what I'm trying to understand.
Yeah, they're just grouping it by zip code when they give me the data. All the cancer data will be at the individual level, but they'll be kind of stratified by what zip code they lived in.
Okay, so how are you going to account for the social demographic data that you have at the zip code level and applying it to the individual data?
Mm-hmm. I hope to consider the sociodemographic variables in a multiple linear analysis. Does that answer your question?
Okay, do you mind talking to me later after this?
Yeah.
Okay.
Of
All right,
course.
thank you.
So, given that we know from national population-based data that blacks and whites have different cancer rates for various cancers, you know, those data from SEER are available. And given that you have this big disparity in likelihood of being black north and south of the Mason-Dixon line, or the Del Mar line, right? Why aren't you simply going to be finding that zip codes that have more black folk are going to have higher rates of cancers that we know are present in higher rates in blacks nationally, and cancers that have higher incidence in whites than blacks would be found in the region that has the most white folk, if
Yeah.
you're just grouping everything by zip code.
Yeah.
Are you going to do a subset analysis within the zip codes for blacks versus whites?
That's an interesting suggestion, and that would be a really good follow-up. I would be interested into looking into that. It will also be interesting, I hope, to compare the rates to the national rates based on cancer. Like, are, African American people even more likely in St. Louis? Like, is the disparity even larger than on the national level?
Right. I mean, you really have two. I mean, there's a lot of studies that have been done on racial differences, obviously, and then there's also a lot of studies that have been done on socioeconomic status and how that relates to cancer. And it seems to me that you're kind of blending those in a way. And I think that I realize that you can't get the socioeconomic data on an individual basis, but you can get the identified ethnicity on an individual basis.
Yeah, that's likely the case.
Right.
A subset analysis
From the
would
registry,
be, yeah,
right.
would be interesting, like you suggested. Are there any more questions? Oh, wait, one more in the back, maybe?
I just have two suggestions on how to approach the data in terms of having the zip code level information for the social demographic data. One way to look at it is to do a domain analysis, and then the other way is to do a mixed effect model. And in the mixed effect model, everyone within the same zip code, the zip code level will be your analysis unit instead of the individual, because everyone within that zip code, you are assigning the same social demographic information to them. So they become one unit. So,
Yeah.
okay.
Okay. You seem to have some insight, so I'll definitely try to meet with you after everyone's presentation. Anyone else? Okay, thank you.